PCTI introduced the concept of document management into UK general practice back in 1993. Since then, PCTI has been the market-leading document management provider to the UK primary care market. Tested to the highest standards, Docman already benefits over 5,000 GP practices nationwide, which includes a complete procurement in NHS Scotland. Docman handles over 20 million registered patients and is responsible for the processing of some 1.2 million documents per week. PCTI are specialists in their field and support all of the key clinical providers. This means full integration is available from in-practice system Vision, iSoft Premier, Synergy, EMIS LV, EMIS PCS, and Docman is also the only document management system to gain EMIS Web accreditation. With Docman 7 and Docman EDT, PCTI are connecting hospitals to GP practices nationwide, providing a fast and secure method for document and data delivery. It is apparent that with the ever-increasing workload, the current method of managing paper within general practice is neither sustainable nor proficient in order to continue providing world-class patient care. There are a number of factors a practice should consider that affect the way in which documents are managed in and around the practice. These are the method in which these documents are delivered, first of all, to the practice. These may be by email, by fax or by post. The method in which these documents are then attached to the relevant patient record. The way in which these documents are retrieved from the patient record, either in a consultation or perhaps when looking at reports. The way in which correspondence flows around the practice, this being the paper flow or workflow process. The practice should assess the circulation of this communication, checking out whether they're auditable, secure and efficient. Both clinical and non-clinical correspondence is delivered to the practice through email, fax and post. In some cases this can result in the same letter being received more than once, resulting in a duplication of process for one or many members of staff. For patient-related documents, this problem has even greater consequence, as the duplication of clinical letters can result in a miscommunication to patient and even affect the quality of care a patient receives. A typical surgery environment, the process can be described as follows. The administration team open the post, or download it from an NHS mail account, or retrieve it from the fax machine. Each document is then stamped with today's date, and then scanned and attached then to the patient record. This procedure relies heavily on the staff members choosing the correct patient to attach it to, and then passing the piece of paper or the relevant document onto the right doctor. Although today's practice staff are usually highly skilled and reliable, there still remains an element of human error with this method. There are two main drawbacks identified when working to this model. Although the document is immediately viewable from the patient record, the current method of retrieval is not straightforward. The other key disadvantage is that even though this document is held electronically, the original copy, or the paper copy, then has to be passed around the surgery. In the majority of cases, each document will be marked with comments and further actions that are not immediately accessible from the electronic patient record. In some instances, it may take a number of hours or even a number of days for the document to reach the correct recipient, and a further period of time for actions to be carried out. This document could also become lost, damaged, and along with those actions and comments, resulting again in the duplication of many processes. The Docman method is a much more efficient, secure and auditable solution for document management. Patient letters are accessed directly from within your clinical system. The documents are actually attached to the patient record. With just one click, the user can view all documents attached to a particular patient record. The document viewer appears, displaying the patient's documents in chronological order. These documents can be easily viewed using the keyboard or the mouse. The patient documents can also be filtered by folder. Audit trail information is easily accessed, showing a full comprehensive document history. This displays the date and time of the action, the user that performed the action, and the computer they were on. Documents can be batch printed or exported easily using the document viewer. Docman enables instant access to up-to-date results with a single mouse click from patient clinical record. Even if documents are in a particular doctor's in-tray, this ensures the information can be passed back to the patient as soon as it's received into the practice. When filing a document, Docman allows users to quickly capture and file physical and electronic documents directly into the patient record. Using advanced technology, IntelliSense automatically detects which patient a document is to be attached to by identifying the forename, surname, date of birth and an HS number if available. Using this same technology, IntelliSense assigns a description to each document with categories such as clinic date, hospital, department and consultant for easy retrieval.
The user can then choose whose workflow in tray or inbox they wish to send the document by simply selecting the user's name or simply by choosing from one of the predefined routes. For the purpose of this demonstration, I will choose a specific user's in tray.
This provides a fast, more accurate and standardised way of attaching documents to the electronic patient record. If at any point the user wishes to override the results, the user can simply untick a field and a pre-populated picking list will appear for the user to choose from. Docman simplifies the workflow process by easily presenting electronic letters in front of an individual to review. The document can be simply highlighted in numerous colours to either make it obvious what information a clinical coder should be entering into a patient record, or to simply highlight important information relevant to this patient care. GPs will spend less time on administrative tasks whilst being able to access information from any computer in the practice and update patient data instantly. To pass this document on to a relevant team member for coding or appointment, the user simply uses one of the click steps on the right hand side. This marks the document with that particular action and automatically forwards the document onto the relevant team member. The clinical system function provides a direct link to the electronic patient record, ensuring fast and accurate interoperability between the letter and the clinical system. The Summarise function provides coding teams and GPs with an easy-to-use read code detection facility. Detect Diagnosis will deliver the user a list of clinical codes found on the letter from key words. Detect All will deliver the user a list of procedure and administration codes, again found from key words on the letter. This will allow the user to insert these codes into the patient record. If the code you are choosing is already part of that patient record, a no entry symbol will appear in front of the code as a warning. This will avoid duplication of codes being entered into a patient record, ensuring data quality for QoF. In systems like EMIS LV, EMIS PCS and EMIS Web, the software will now ask you whether you want to make this an active or a past problem, a significant or a minor problem, a new problem, or, as displayed here, some of these are already warnings. We can make it a review of that problem instead.
Docman also has a full non-patient document management area, which is accessed from the main menu. These sections can be created by the practice easily and security rules set to allow practice-defined user access. Sections a practice may find useful are pre-installed, such as surgery documents and secured documents. This folder structure can be easily maintained by the practice. Like patient letters, these documents can be in many formats, such as Word documents, PDFs, TIFFs and emails. Once in an area, and if a document needs amending, Docman allows a fully audited way of checking a document out of the system to ensure proper version control.